is a question for you. How are you feeling? Like really feeling? Are you feeling a little achy? Do you have some chills? Perhaps a fever? These are all signs that you might have the flu. So what do you do?
So what do you do?
So what do you do?
You get it.
Well, Dr. Ken Norcross, you get him on set to tell us what to do. Welcome to the show this morning.
Good to meet you guys. Thanks
Pleasure
for
to
having
meet
me
you,
here in
Dr.
beautiful
Redcross.
Tampa. I mean, this is the show to come on. We're talking about beer. We're talking about Victoria's Secret.
Oh, we got
models.
it
Right.
all.
This is the place to be.
Cookies and the flu.
I know.
Absolutely.
We cover it all. We cover it all.
Absolutely. You know, thanks so much for having me on because this is so important. Everyone's thinking just because now we're in March that it's almost over. I'm here to tell you, unfortunately, the
Yes.
flu looks like it's going to go all the way into May this year.
Oh.
No.
So-
is it a little stronger? I feel there's a little bit more, a rougher flu that we're going through this year.
It's a good point. It's not so much stronger, but you know, we've had such wacky weather, especially in New York. It'll be 1 degree and then it'll be 50 degrees the next day. So I think the flu or influenza itself is kind of confused. You know, whenever I really think about the flu season, I always liken it to that of hurricane season. And you guys are aware of that season. And what do we do? We prepare and we stockpile. And that's what we should do with some of these things I kind of have in my kit to get ready. So one of the first things I love to talk about is a probiotic. Now, a probiotic, I think we all know that they're good for us at this time, but we don't really understand that when we get sick, we lose a lot of the good bacteria in our gut that's so important for our immune health. So it's important to make sure you supplement that way.
Okay.
The second thing is there is a wonderful homeopathic remedy called Oscillo. And Oscillo's been shown to decrease both the severity and the duration of illness when taken within the first 24 to 48 hours. And what's even better is that it's good for kids 2 years of age and older. Yes. And I don't know about you guys, but I remember some years ago, we didn't know what to give our kids when they came down with something.
Right, because you always hear the flu, like there's nothing for the flu except like, your mom's chicken soup or something like that, or chicken broth or, things like that.
Well, back to mom's chicken broth, actually. Actually, mom actually has data. It shows that chicken noodle soup can actually slow the migration of white blood cells to those areas that can wreak havoc, such as to our lungs when we get the cough or to our nasal passages where we get the sneezing. So mom is always right, so we have to remember that too.
And what are some of the ramifications if you don't go directly to the doctor, if you wait over that 24 or 48 hours?
Yeah, influenza is not just about having those flu-like symptoms that you touched upon, Stephanie. It's actually also thinking about pneumonia, especially in our susceptible population, 65 and older, and our young kids. Yes. So we have to be careful. Some other things that we can bring in to help us out too are zinc. Zinc is very valuable.
I've heard that too, that can shorten the duration again, isn't that another?
Absolutely, and not only that, only thing that I caution everyone, make sure you have something on your stomach because zinc can kind of bother your stomach a little if you don't. And the last thing is vitamin D. Vitamin D is now shown that when it's deficient, it increases the susceptibility. And it's so important now that there's a group called the Organic and Natural Health Association that has decided to focus the entire year on getting the word out about D, and even have kits at thepowerofd.org where you can check your own vitamin D in the comforts of your own home.
Now, some of the fallacies you say, if I've already had the flu shot, I already had the flu, can I still get the flu shot and it work?
Great question.
That's an awesome question because what happens is that, don't forget, when we make this flu vaccine, we do our best to get the strains that we think we're going to see. So let's say we get the strains for A, B, and C. It doesn't mean you won't get flu X and Y and Z.
I think I had that one a couple weeks ago.
Yeah, exactly. I heard, unfortunately. I wish I were here a week earlier. I could have helped you. So you still need to get the flu shot because you may not have it against the same strain, but never get the flu shot if you have any symptoms such as a fever.
All right. Well, thank you, Doc, for joining us.
Thank you, as always.
Absolute pleasure.
Thank you guys for having me.
Yes, some good tips for there. All right.